Hello, my name is Jill Berry Bowen, CEO of Northwestern Medical Center, and your host of the Health Beat show. We're dedicated to your healthcare topics. So today we're going to be discussing NMC's Master Facility Plan. There's been a lot of changes going on, as you know, regarding healthcare, so it's important that our facilities keep up with the pace with your community needs, ensuring access to care. So today I have with me two of our experts on the topic about our plans for the project. I have Jonathan Billings as our Vice President of Planning and Community Relations, and I have Tyson Moulton. He's our Director of Facilities, Plant, and Property. So Jonathan and Tyson, thank you so much for being here with us today.
My pleasure. Glad to be here, Jill.
Thanks for having us.
So Jonathan, everybody knows you. So how long have you been with the hospital?
I just celebrated my 25th year here at NMC. It's been a wonderful career here.
That's terrific, and you're a fabulous face to the hospital for the community. So thank you for all your great work. But we do have a new face. Tyson, you haven't been with us too long, but you've been so effective already. So tell us a little bit about yourself.
Well, I've been with NMC for about 6 months now, and I came here from Gifford Medical Center in Randolph, Vermont. Mm-hmm. I have a background in construction management, and I'm a native of Colchester, Vermont.
Great. Thank you so much. Well, it's been wonderful having you on board because you've been able to go through the project details with great accuracy, and you've really helped us fine-tune it. So thank you for that. So let's jump into it. So what are the components of this project that we're talking about at the hospital?
It's an exciting time for us. The project came together through the community needs assessment and then our strategic planning process, and we've been refining it over the past few years to really focus on the highest priorities. And that's brought us to three major components of the plan. The first is a new attached medical office building, which will pull primary care and urgent care to the front of campus to improve access, to bring that right up front, just where it's headed in healthcare reform, is primary care at the front of the effort. That building will also provide efficient new space for our orthopedic practice and allow us to integrate interventional pain right into orthopedics. Best of all, it carries a shelled second floor, which provides us future flexibility so that as the healthcare needs of our community grow and change, we're able to keep pace within that existing facility. So a very flexible facility for us right at the front of campus. The second component is also at the front of campus. It's an addition right at the main entrance, and it allows us to improve access to the physical building itself and centralize our registration, which creates significant efficiency for us and streamlines patient access and throughput. It provides expanded space for our growing medical cardiology and pulmonology practices that are currently chafing right up against their capacity. They've been wonderfully received by our community. It will allow us to bring our OBGYN physicians into the same building as the Family Birth Center, increasing their efficiency. And again, best of all, it provides new space for medical clinics. It will allow us the flexible, efficient space that we can reestablish those clinics that are needed in our community, but not full-time. They would be part-time specialties to meet the preventive needs of our communities. Things like dermatology, endocrinology, rheumatology, and neurology that might be needed here 2 days a week, 1 day a week, 3 times a month. Practices that can't support a dedicated space of their own, but by sharing flexible space can be here in an efficient manner and really avoid conditions for patients getting escalated before they can be treated. And then the third major component of the master facility plan is towards the back of campus, and that's where our existing medical, surgical, and intensive care units are. And this project allows us to convert those medical, surgical, and intensive care unit beds into all private beds. Right now, those are double rooms, and so patients have roommates much of the time, and that's not best practice in medicine anymore. 20, 30 years ago, it was. But now, as you look at privacy and infection control, patient restfulness, even patient education and family engagement in the care of a patient, having a private room really is evidence-based and best practice. And so we'll be able to convert our existing rooms to private rooms and then add on so that we have the right number of private beds to meet the needs of the community, not just now, but in the foreseeable future as well. And so that's a real advancement for our healing environment. So those are the three big components that we're looking at for this project.
Wow, that's a fabulous outline. Now, as you think about going forward, you know, this patient bed numbers, are we increasing the bed numbers in the inpatient, or how are we adjusting for the future?
Very interesting question, because the math doesn't quite work the way you think it would. We currently have 40 inpatient rooms or inpatient beds, and we'll be building 34 private beds. And it's a reduction in bed count, but with the flexibility and efficiency of single rooms, we actually have the same, if not greater, capacity at 34. We've looked at our numbers very carefully and looked at forecasts that call for a decrease in inpatient admissions through healthcare reform, but also we have an aging community. And so we may not follow that path as exactly as the rest of the country may. And so with private rooms, you don't have to worry about what's the gender mix of your patients, who's infectious, who's not, who's a good candidate for a roommate for social reasons, who's not. It allows you to dedicate a healing space to a patient. And with that efficiency, we're able to move forward with 34 rooms.
Great, excellent, thank you. So this seems to be a lot at the front and the back. So what's the timing of this? How does this all work?
Well, Jill, as you know, Vermont's a certificate of need state, which means that we have to put in an application to the Green Mountain Care Board for approval. All major projects that hospitals do in the state of Vermont go through this same process. And so that's the first step, and we've already submitted our letter of intent to get that process going. And we'll be following it up with an actual application here this month, in November. After that, we will move into the design work for the med-surg ICU expansion, the private patient rooms that Jonathan was just talking about, and for the medical clinics on the front side of the campus, and simultaneously go into a permitting process as well, and that includes the Act 250 process, stormwater, water and sewer allocation, V-Trans permits, the whole gamut of permits that we need to go through before we start building. We expect that whole process to be about 9 months long. So that puts us about fall of 2015 for breaking ground on the main project.
Just a year from now. That's that's exciting.
Yes. Yeah. Yes. Very exciting.
So, what is the community going to see that comes first? And so what should they expect?
Right.
And also talk a little bit about, is there the campus disruption? I'm sure when this all starts, how do we still take care of patients and keep the access? Because we're a pretty busy campus.
Exactly. Yeah, campus disruption is something that we're looking at very closely as we're planning the phasing of the project. Because any disruption to the campus, that is going to limit the patient access to the actual building and the provision of healthcare, is going to be a serious concern. So. So the first thing that the community is going to see is our Crest Road move. Now, Crest Road is the road that you basically come into campus on. So it's right off of Fairfield Street, and we're going to pick that up and move it 90 feet to the east. And there's a number of different reasons for doing this move. One of them being pedestrian safety. If you've come in, it's there's I think 7 different crosswalks on that road.
Wow.
So we'll really consolidate those into a more formalized pattern, also improving traffic safety, and also adding much needed parking to the front of the campus. I know that our visitors oftentimes struggle to find spaces. It sometimes overflows into the doctor's office common parking spaces. So really expanding that so that we can provide adequate parking for our visitors. So that's planned for the spring of 15. And we'll be keeping the access to campus from that point for all but maybe a day when we're paving. So we'll be building the new road that'll be 90 feet to the east while there's still traffic on the current location of Crest Road. and then once we get that road roughed in and a base course on, we'll move traffic to that road while we build parking where the current location of Crest Road is. After the Crest Road move, we'll be into the Med-Surg ICU expansion in the fall of 15, and that'll start with relocation of the loop road. Right now, it tucks pretty close to the Med-Surg wing.
It does.
So that'll have to go back, and so you can see where it currently loops around the north side of Med-Surg ICU. That's currently a parking lot right now. So we'll have to take up that parking lot, reroute the road, and then we can get into the foundation work for the Med-Surg ICU expansion.
Wow. It's going to be a lot of activity on that campus.
Yes, it will.
So it's exciting and certainly an investment in our future.
Absolutely.
All right, so the big question is, what's this going to cost? And what does it mean to the community? Is it going to increase the cost of health care? Where's this going?
Yeah, that's a great question, and it's an important one that we have worked hard on. The total of the three projects altogether is roughly in the $31 million range combined. And so that's a significant investment. That's a once-in-a-generation investment. As you look back through my 25 years, we haven't done a set of projects that reach that dollar amount. The people will remember back in the late 80s, early 90s was the last truly major group of projects, and that was the new emergency department, the new family birth center, the overhaul of some of our patient areas. And so this is a once-in-a-generation investment, and our board has anticipated that. They've been working for years to position NMC wisely to be able to take this on so that the impact of that investment, that $31 million, is mitigated. We have saved for this project. Our community also has a strong history of philanthropy, and we know that there is support out there for it. But at the same time, we're also very cognizant of our costs. And a large part of what drives these projects is efficiency-mindedness, is positioning ourselves for healthcare reform. And as I describe the projects, I probably used the word efficiency over and over. And I apologize for the repetitiveness, but it's a theme. We're looking at, okay, where do we have practices in leased space that could be more efficiently housed within hospital-owned space? We're looking at where do we have duplicated services so that we can create efficiencies and lower costs. We're looking at where does our design make our staffing inefficient so that we can use our staff better. And as you work through those, by containing those costs, you're able to absorb the ongoing costs of the project itself, and you can minimize the impact. Tough to say minimize and $31 million in the same breath, but that's been our push, is to really look at what fits within the means of the hospital. Over the years that we've planned this project, we've scaled it back significantly to really focus on what do we need. A brand new shiny hospital is a wonderful thing, but it would be far too expensive, and in truth our facility has such good about it that it doesn't need to be replaced. And we looked at other areas that might be candidates for renovation, and we'll address some of those in smaller projects. But if you look at the true focus and where is the real need, because NMC's facility is now 59% older than the average Vermont hospital.
Wow.
And so it's time for us to really invest in this. And these targeted expansions, that $31 million investment in the healing environment, we think is prudent at this point. And the board has approved us moving forward because of that.
Wow. Exciting. Just totally exciting.
It really is. It's a great chance for us to really position the hospital to care for the community well into the future.
Exactly, exactly. Well, you have been incredible guests on this show, and I know we have just started to answer some of the questions because there's going to be more to come, and I look forward to more education to the community so that we can really get the community aware and involved and as excited as you are about this project. So thank you. So this is Jill Berry Bowen, CEO of Northwestern Medical Center. Thank you for joining us on the NMC Health Beat Show.